Hello, dear colleagues. My name is Halyna Padalko, and today I'm glad to present you our research, evaluation of the informative features of cardiac studies, diagnostic data using the Kullback method. Many modern medical institutions have information system for storing various medical data on the health of patient used by doctor recognize, diagnose, pathological process. The use of modern information technologies in medical contributes to accumulation of huge volumes of medical data stored and processed using medical information system. Mathematical process of the initial medical data allows you to determine the diagnosis value of indicators of the complexes in the future. It's helped to build an optimal examination plan and significantly reduce the number of studies required for diagnosis and unlimitedly improve the quality of computer diagnosis. There are several reasons for the possibility of transition for larger number of baseline indicators of the patient condition to a significantly smaller number of the most informative features. Low informativeness of individual features, balanced simulation of some features, and the construction of generalized features. Assessment of the informativeness of the diagnostic site is necessary for their objective ranking in order of importance and determination of the order of the consideration in the process of making diagnosis. The aim of the study is to analyze mathematical models for accessing the information content and develop a model of assessing the information content or diagnostic data from cardiac studies. Any biometrical information processing is dedicated to specific purposes such as research, treatment, breeding, etc. Perhaps the most important goal of medical research is the classification of the object or in relation the patient and the disease diagnostics. In particular, the assessment of the informativeness of sign is used in medicine in the diagnostic of numerous diseases. Further treatment of the patient depend on the result of the diagnostics. It is possible to make a diagnostic that is to recognize this or the disease or its absence, provided that the characteristic inherent in the objective in medicine's patient are analyzed. Informative indicators and indicators that make the greatest contribution to characteristic of the state of the object, such as patient. There are numerous methods for determining the informativeness of features. However, unlike other criteria for the statistical significance or of difference, the Kullback measure allows one to access not the reliability of difference between division, but the degree of the differences. As a matter of the analyzing side, by accessing the informativeness using the Kullback information measure has been widely used in medicine when considering individual factors that influences the diagnosis. In this method, the measure of the difference between the two classes, which is called the divergence, is amused as an amusement of the informativeness. To measure the amount of information, Wiener and Sherman independently from each other propose logarithmic measures, which are recognized as a quantitative measures of information. To the class of similar logarithmic measures belong in and is similarly studied as a Kullback information measure J, is a discrepancy between the typical distribution 1 and 2. For discrete distribution, this measure is related by the formula of the slide, where DC is a diagnostic coefficient. The Kullback method of evaluation of informative measure is based on the calculation of diagnostic coefficient. The diagnostic coefficient is presented in a form of the logarithm of the ratio and the probabilities of manifestation of this feature in the mean of control group, as it's shown on the slide. Diagnostic coefficients are most often ambitious of single digit positive or negative numbers. That is the diagnostic coefficient with the plus sign speak for the greater likelihood or hypothesis A about belonging to the main group, with the familiar minus is about greater likelihood of hypothesis A2 about belonging to a control group. Obviously, the coefficient with a positive sign carry a positive information, brings the sum of diagnostic coefficient closer to the whole, which is positive for A. Coefficient with a negative sign, on the contrary, removes the amount from the whole. For hypothesis B, on the contrary, coefficient with a negative sign bring the sum closer to the whole, and coefficients with a positive sign see it from the whole, since the whole is a negative value. It should be noted that the greater in the value of the diagnostic coefficient, the more differential diagnostic information, that is, information about the prevalence of the probability of one of the diagnostic it carries. However, the informativeness of each value of the trait depends on the frequency with which this value occurs in each disease. If the diagnostic coefficient for determining the sign XGI is too large, but patients with such knowledges are relatively rare, then in the process diagnosis, the role of such a value of the sign XGI is too small. There are considered method in the comparison with other methods are assessing the information content is the simplest and more accessible for algorithmization. His adaptation machine is not laborious and doesn't entail significant computation cost and resources. The input data in our task is data set of information on the diagnostic data of patient based on cardiac studies, the age, gender, type of chest pain, cholesterol level, a complete list of parameters which are shown on the slide. For software implementation, the C# programming language was used in Microsoft Visual Studio environment. To start the software package, you need to download the data presented in the file you see. In total, for example, data from 303 patients and 13 features was taken. The age, gender, type of chest pain, cholesterol level, ECG, blood blood pressure, maximum pressure, blood sugar level, type of pressure of tonsilline, colored vessel, etc. The data of divided into two classes, A healthy and B sick. The results of the calculation of the Kullback method for assessing the informativeness of the attribute aim patient age are shown on the slide. Kullback method gives an estimate of the informativeness of the study's features in a form of the value, taken values from 0 to 2. In this case, it is believed that the closer E from X to 2, higher the informativeness for the feature. On the contrary, the closer I from X to 0, the lower informative value of X. As a result, the information content was calculated for various groups of cardiac data. We got the following side of the most informative: thal, chest pain type, colored values, angina age. The Kullback method is used to determine the informativeness of a feature that is involved in recognition of two classes of object. Also, a comparison of Kullback method with other methods for accessing the informativeness of feature are made. As a result of the study, methods of accessing informativeness of site for media data were analyzed. The Kullback method was chosen as the most appropriate method for medical data. On the basis of the Kullback method, a model of accessing the information content was built as a software package was implemented. For the experimental study, data from 303 patients and 13 features were used. The information content was calculated for various groups of cardiac data. We got that the following signs are the most informative: child, chest pain type, colored fascia, angina age. The Kullback method is used to determine the informativeness of a feature that is involved in the recognition of two classes of object. Also, comparison of the Kullback method with other methods for assessing the information of future are made. Thank you for your attention.